Hello BDS students, welcome to our another video based on oral patho. That is the topic we have today is leukoplakia. So before starting, I have a scenario for all of you guys. Just focus on this and all your questions will be answered as soon we will keep progressing this video. So first listen the scenario I have. So imagine that a middle-aged smoker comes to a dental clinic for a routine checkup. He has no pain, no swelling, no major complaint. But while examining his mouth, you notice a white patch on the lateral border of the tongue. You try to wipe it away, but it does not come off. Now, this is where every dentist should become alert because this could be one of the most important, potentially malignant disorders in oral pathology, and that is leukoplakia. And today we will understand this topic in a simple clinical way that you will actually remember it in exams and clinics. So, starting with the definition. First understand the most important concept. Leukoplakia is not a histological diagnosis. It is only a clinical term. It simply means a white lesion that cannot be characterized clinically as any other disease. So when you hear the word leukoplakia, don't think of one disease. Think of a spectrum. It can be completely harmless or it can already be turning into cancer. And that's why histopathology becomes extremely important. So, moving forward towards the etiology or risk factors. Now, let's talk about causes. The strongest and most important association is tobacco. Whether smoking cigarettes, bidi, cigars, or chewing tobacco. Then, alcohol further increases the risk, and when tobacco and alcohol are combined, the malignant potential rises even more. Other causes include chronic irritation from sharp teeth or faulty restorations, heat burns, chemical burns, and there could be ultraviolet exposure in lip lesions known as actinic cheilitis. So clinically, if you see a persistent white patch in a smoker, never ignore it. Moving to the reactive condition. Now here's where students usually get confused. Not every white lesion is dangerous. Some are simply reactive changes. For example, hyperkeratosis where there is increased keratin formation, acanthosis meaning thickening of the spinous layer, nicotine stomatitis, snuff diapers keratosis, and even thermal or chemical burns. These may look similar clinically, but histologically they can be completely different. So, now moving to the neoplastic causes. Now comes the high yield part. Some leukoplakic lesions may actually contain pre-malignant or malignant changes. These includes epithelial dysplasia, carcinoma in situ, squamous cell carcinoma, and varicose carcinoma. So remember this important line for exams. Leukoplakia is not always benign. In some patients, it may already represent oral cancer. Moving forward, now let's quickly cover other conditions that can appear white in the oral cavity. First is infections include chronic hyperplastic candidiasis, as you can see it, hairy leukoplakia associated with Epstein-Barr virus, and syphilitic mucus patches. Immune-mediated conditions include lichen planus and lupus erythematosus. So they are not written here, but I am just telling you. Some hereditary condition like white sponge nevus and leukoedema can also produce white lesions, and idiopathic conditions like hairy tongue or geographic tongue may clinically resemble leukoplakia. So clinically, you always need differential diagnosis. So that's why I told you about these differential diagnoses. Coming on to the histopath. Now let's move to the histopath, the most important exam area. The microscopic appearance can range from completely benign changes to full malignant transformation. The most consistent finding is hyperkeratosis. Important line for your exams. Other common findings include hyperkeratosis and acanthosis. Sorry for that. If dysplasia develops, you may see nuclear pleomorphism, increased mitotic activity, and loss of normal epithelial stratification. These are major warning signs for malignant transformation. Now, the question is, why does it look white? Now, a common viva question. Why does leukoplakia appear white? The answer is very simple. The oral epithelium is avascular, and when the keratin layer becomes thick, it blocks the visibility of blood vessels underneath. So the normal pink or red color becomes hidden and the lesion appears white. In some lesions, reduced vascularity and increased collagen in connective tissue also contribute to the white appearance. Now coming to the diagnosis. Now comes the most important clinical step. Can you diagnose leukoplakia just by looking at it? The answer is no. The gold standard is biopsy. If the lesion is small, you remove the entire lesion. That is called an excisional biopsy. If the lesion is large, you remove only a representative part. This is called an incisional biopsy. And if the lesion is multifocal, multiple biopsy sample may be required. Always biopsy the most suspicious looking area. Now coming at the treatment and final example. So finally, how do we treat leukoplakia? The treatment depends completely on histopathology. If the lesion is benign, you eliminate risk factors like tobacco and chronic irritation and keep the patient under follow-up. But if dysplasia or malignancy is present, complete surgical removal becomes necessary and long-term monitoring is extremely important. So let's finish with the key takeaways, okay, which I have told that leukoplakia is a clinical term. Biopsy is essential and the most major risk factor is tobacco. And every leukoplakic lesion must be considered potentially malignant until proven otherwise. So now ending this video. If this video helped you understand leukoplakia clearly, make sure to subscribe for more exam-oriented oral pathology content simplified in easiest way possible. And I will see you in the next video. Kindly subscribe. Here are the image sources for which have been used in these slides. I hope you better understand and you are getting something that will help you in exams and in your clinical life. Just give a subscribe so I keep making these educational dental videos. Thank you and subscribe to Last Night Dentistry.